بدينا بالمراجعة شوية. اوكي good. أنا إن شاء الله الأسبوع الجاي بعد I'll prepare some questions again, okay, and we'll have a revision with you before you sit for your exam, okay. So I'll do something like that for the systems that I did not cover or so. So we'll have another revision to go with next week inshallah, okay. Up to this week, yani today and tomorrow, okay, will be with us in the midterm. Yani axial skeleton, appendicular skeleton, vertebral column, and the thoracic cage. All this will be with us in the midterm, okay. And the midterm this term will be, rather than 60, it will be 50 questions. مو ب 60 50 سؤال زين. 30 بيكونوا anatomy و20 physiology. Okay, so we have reduced it slightly, so it will be 30 questions anatomy, 20 سؤال بيكون physiology. Okay, وبعدين الأسئلة ما فيها صور. بتكلم عن الاناتومي. There will be no pictures, and the question will have 4 choices only, مو بخمسة. Okay, so you'll pick one answer between the 4 choices as the right answer. Yes, please. نعم. هذه مو صوبي، صوبهم ما ها. أي. أنا صوبي أن I will tell you that you will have 50 questions. إيش قد وقت حددوا له هذه إدارية هاي. Okay, they will let you know with that. But I will prepare later for the final, okay, because for the final you will have OSPE exam as well, where you will have pictures, you will have models, okay. So even if you now memorize the pictures, they will help you to understand for the final exam, okay. So final, would it have pictures? Yes, it will have. Would it have the models? Yes, it will. I might put the skull on the table and ask you, okay. So it will have. All right. So for that one, you will prepare. Once you finish with the midterm, start preparing yourself for the final as well. Okay. So and number 2 is, once we finish with with this system, the first term, after the final, for the second part for anatomy and physiology is the same book for anatomy and physiology, okay, but it will go into systems. So respiratory system, cardiovascular system, reproductive system, so it will go into systems in detail, okay. And at that time, for the next half, your resource person will be Dr. Rauf, okay. So I'm with you for the first half, he will be with you for the second half, okay. Let me close the door. بيعودكم على اللهجة المصرية تعرفونها عدل. Okay, we'll look at the lower limb. We have done the upper limb, we have done the bones, we have done the axial. We had both axial and appendicular skeletons, and then we came to these 2 girdles. We said there was pectoral girdle and pelvic girdle. We have done the pectoral girdle, and we had a look in particular about the clavicle, okay, and the scapula. Clavicle, احنا قلنا what type of bone is that one? It's a long bone. It was considered as a long bone because it has 2 ends, whereas embryologically it doesn't have medullary cavity as a long bone has. This is the first bone to ossify in your body, okay. And since it developed as a spongy bone, okay, but since it has both the ends like that, it's a weak bone, and since we said it's an S-shaped bone, it's easily breakable, and we said whatever, when you fall you're imbalanced. When I fall, I try to protect myself, so I stretch my arm like that. Damn. What do you think? Yeah, it's also flat bone. Scapula, flat bone. Okay, if you pick it up, it's whole flat bone. Now, when you fall, the fall over here, the force comes, either you have a fracture over here, these are strong bones, you don't have it, then the force goes over here to the clavicle, and you might get a fracture of the clavicle at the junction of the S shape, and the medial two-third and lateral one-third. Okay, that's very likely to have. The risk is the apex of the lung comes above the clavicle, about 1.5 inch. So the lung is also over here. So if the fracture takes place and it punctures the lung, you end up with problems. Okay, so air will go inside, then that's a surgical procedure. If it is not like that, then we don't do the surgical procedure. It's manipulation, and we put figure of 8, something like that. But the risk is, so anybody like that has to be investigated, because there is a risk of having rupture of the lung. Okay, now we come to the pelvic girdle. So this time when we look at the pelvic girdle, we'll be looking at the pelvis, and we will be looking at the bones of the lower limb. First we'll start with the bones of the lower limb, then we'll go to the pelvis itself. Okay, and to begin with, we'll look at the bone of the thigh. Okay, and that is the femur, which is the strongest bone that you have in your body. Okay, now the femur being the strongest bone, why is it so strong? Why? Because your thigh has a lot of strong muscles. Your thigh is full with muscles, and you need muscle attachments. Okay, so all those muscle attachments for the thigh, you need strong bone for the attachments. Look, remember we spoke about the deltoid. I told you the deltoid is attached over here to the humerus, and there is a tubercle for it. It's a strong muscle. Okay, so it attaches to that tubercle, deltoid tubercle. Okay, the same I have when you look at the femur in the museum, you will see many areas of it, okay, where they are rough. Why are they rough? Because of the attachment of muscles. Okay, now over here it's a very strong bone. It has proximal and distal articulations. So I have an articulation with the hip, and I have an articulation at the knee. Articulation at the hip, what type of joint is it? Is it fibrous, cartilaginous, or synovial? At the hip, the femur, is it fibrous, cartilaginous, or synovial? We all agree it's synovial. Okay, معناته when you say synovial, معناته the joint should have synovial fluid. Okay, within the joint there should be synovial membrane, synovial fluid. At the ends of both the sides of bone is hyaline cartilage, not any other type, and outside is fibrous capsule. So all these four things, when they are there, whether it's this much or this much, if you have synovial fluid, you have synovial membrane, you have hyaline cartilage, and outside you have fibrous capsule, synovial. زين هذه بعدين بشوف أنواع السينوفيال. Okay, then we have types of synovial, but to label it synovial. All right, now for the femur, when I look at the hip, what type of synovial is this one؟ شوفوا الحين السؤال لو بيجي ساعات واحد إنه what type of joint is this one؟ والله يجيب synovial. أنا ما بقول لكم لو سألتك what type of synovial بعدين لما بعطيكم الجوينتس أبي دقيق. Okay. Now what type of synovial? Then this one is ball and socket. Is it؟ عندي hinge and ball and socket, ellipsoidals, عندي أنواع في synovial. Okay. Then you are specific with what type of synovial. The one over here is ball and socket. طيب the one over here at the shoulder بعد ball and socket لا. Okay. So this one is also ball and socket. This one is also ball and socket. Which is more stable? The hip or the shoulder? The hip is more stable. Which is more mobile? Shoulder. Now, why is it like that? Because at the shoulder, the acetabulum is like that, but at the hip is like this, and the head of the femur goes in. So this one doesn't come out easily. So more stable but less mobile. Okay. So if when you look at the stability versus mobility, then this one is more stable, less mobile, and the shoulder is more mobile but less stable. Okay. We'll also have, when I look at the distal end, then we'll look at the knee joint. Okay. Knee joint is also a very complex joint. It's not only flexion and extension. Okay. So it's a complex joint because it also has rotation. Okay. But we'll not go to that at this stage. We'll see later over that. Distal end, we'll have it with, we have two bones in the leg. Those two bones in the leg are tibia and fibula. Tibia and fibula. Okay. The bone that articulates, takes part at the knee for the move for the joint is the tibia, not the fibula. Fibula راسه بعيد شوية. Okay. So the one that articulates over here is the tibia. Okay. And we'll have a look at that one as well. This is the head for the femur. This is the surgical neck. Now surgical neck, I told you it's important because your weight then when it goes through the lower limb passes through the neck of the femur. Okay. And if you look at the neck of the femur goes medially, then the bone goes like that then. If you look at the weight comes narrower so that your legs can take it. Okay. So here is the joint, look over here, this goes like that, comes medially. Okay. Now the weight over here, it is a strong bone, everything, but whole weight of your body then comes to the surgical neck. Now this area with age, especially with females above 50, with osteoporosis becomes weak bones. Okay. In other words, this is a very likely area for fracture. Okay. Now for females in particular, the maximum cases we have in Salmania for fracture at the hip is this area, and it's fall in the bathrooms. Okay. When they go and take a shower. Okay. Now my advice is please put a stool for them. Tell them when they take a shower they sit and take a shower. Okay. Not standing. لأن حتى الصابونة هذه is very slippery. Either they use a soap or gel or whatever, is it? The floor becomes slippery and there is no place to hang on with my hand. Okay. طيحة واحدة بتكسر. One fall is very risky. Nowadays what we advise for the elderly as well, when they go and change their clothes, okay, we also recommend sit on a stool and change your clothes. Okay. So to prevent any fractures like that. Orthopedic, I have a colleague who is an orthopedic surgeon. I'm also orthopedic. I am a specialist for the back. And a أخصائي low back pain. Okay. So I work on the back in Glasgow. Okay. My area was the back. Anyhow, again we tell them sit on a stool even when they are changing the clothes, so they are relaxed. Okay. Now we look at this end and we look at the both ends. I want you to look at the tubercles, trochanter, lesser and greater trochanter, and look at the rough surface over here because of the attachment of these very strong muscles in the thigh. Okay. Thigh muscles are very strong muscles, so they are both of use for you to look at them. And then we look at the lower medial and lateral epicondyles. This area over here, if I look, okay, another I put some real pictures for you to have a look at them and try to look at them. One is your diagram, one is the actual pictures for the bone itself, so that when you see them in the museum, you will be familiar with them. Hadi muhim, and then when you look at the head, okay. So this goes through the acetabulum, fovea capitis. This one is with the tendinous attachment. This is the surgical neck, okay. Trochanters, and this is the line for the intertrochanter crest or line. These ones, even this one, there are muscles that attach over here, make the leg, be towards the medial side, so the leg doesn't go laterally. Okay, so it's a very strong for muscle attachments. This is the lower end. You look at the anterior and posterior sides. So you have both of them over here. This one is the patella. Patella is a sesamoid bone. Patella is a bone within the tendons. This is the bone at the knee. Okay, so the bone over here at the knee, which is not attached to anything, which is within the tendons, the ligaments, is sesamoid bone, is the patella. Okay. So if I look at the patella, it's a quite large bone. We have some smaller bones in the hand. I put a radiographic and you see this is the patella. This is a lateral view. Here is a femur, tibia, fibula, and this is the patella. Okay. We feel the patella as well when we examine. So we hit on the patella and do the examination as well. Now when I come to the bones of the leg, then you are looking at the tibia and fibula. Which is stronger, tibia or fibula? Tibia. But then tibia is the one which is taking care of the weight and muscles. Is it? And fibula actually does not even participate in at the knee joint. It's lateral to it. Is it? If I look at the tibia, it's more medially oriented. Okay. We look at the attachments over here. Medial malleolus forms the inner part of the ankle, but the lateral malleolus is formed by the fibula, not the tibia. In other words, if I look over here, this one usually with the bones, the medial and lateral is the same bone, but over here the medial malleolus is with the tibia, the lateral malleolus is with the fibula. Okay. But up over here, this is the joint, this one is not participating in the joint, it's lower. فهذه رأس تشوفوا هني, it is over here, it's not over here. Okay. So it's not taking part in the joint itself over there, it's lateral. But this bone, for those who play football, okay, usually they get a hit on the lateral side, okay, while playing football, and there is a nerve that passes from here. Either there is injury to that nerve, or this is a weak bone, you get fracture of this bone, okay, and it's usually on the lateral side when they get hit while playing football. Okay. Another guy comes running to take the ball, hits you with the foot, and it's a very bad hit. Okay. Now here there is another radiograph. I've added this one. So if you look at the fibula, this is the lateral malleolus, this is the tibia, and this forms the medial malleolus, and here is the calcaneus. Then I look at the bones of the foot. Okay. This one for the tibia, and tibia also has rough surfaces. Okay, it has very rough surfaces on the surface because it also gives a lot of attachment to muscles of the leg. Okay, عن المسلز ترى ما احنا معاكم we're not following the muscles, otherwise then we go to the foot and we take each muscle attachments. خلوا في الاعتبار the muscle when it is active it squeezes down, it shrinks, it doesn't expand. So muscle contraction will shorten the muscle. If I, for example, this is the biceps. When I use the biceps, it shortens, so it gives me flexion. When I relax it, I'll have an extension. Okay? Now to have a flexion means it should have an attachment over here and an attachment across the joint. Okay? It has to be, the other attachment is across the joint. So when I contract this muscle, then I will get flexion. Okay? So this is with the skeletal muscles. You have done that, and skeletal muscles are voluntary muscles. Which is the? Okay. Now I put these a few slides for you because they are very clear in labeling them. هذه بيساعدكم حتى حق الأوسبي before the final. Okay? Because I might put bones on the table and ask you to identify some structures. فهذه هذول اللي خليتهم أوضح من الكتاب اللي عندكم. Okay? So besides your book, I put these ones for both the ends. This is for the fibula, which is on the lateral side. Now if you look at the foot, you have tarsal bones, tarsals, metatarsals, and phalanges. Okay? Tarsals, metatarsals, and phalanges. There are 7 tarsal bones. Calcaneus bone is the largest one, and the tendon which is attached to the calcaneum is known as tendocalcaneus. Tendocalcaneus is the strongest tendon in your body. Okay? Strongest tendon of تشوف الجسم, that is tendocalcaneus. Okay? نعم tendocalcaneus, this one, having, this is tendocalcaneus, the one which comes at the foot, at the back of your heel. شوف شباب الهيل هذه this one, هذه أقوى tendon, this is tendocalcaneus. Okay, this is your tendocalcaneus. tendocalcaneus, في حد شاف فيلم أيام زمان على أكليز؟ أكليز was a warrior, زين، كان في الحروب، زين. Achilles, nobody could kill him, okay, and eventually every war they could not kill him, okay. He only died when somebody hit his calcaneal tendon, سام في poison, okay. Yeah, and the story goes his mother was a goddess for water. She dipped him in the water اللي كان صغير، زين، river Styx، زين، بس هي كان مسكته من تندل من calcaneus لين غطسته في الماء. اوكي؟ فجسمه كله was immortal، ما حد كان، فلين عرفوا عن نقطة الضعف هذه، and he was killed when they hit the arrow with poison على calcaneus. Then he died. Okay, have in 1693 something like that. Okay, فإلى قصة يعني على الأكليز تندن. فالاسم الثاني ليش قلت لكم هذه؟ إما بسميه تندوكالكينيوس ولا بتشوفون في الكتاب اسمه Achilles tendon. Achilles tendon. It's the same tendon. Okay? You will look in anatomy books, Achilles tendon. ليش سموه Achilles tendons؟ باسم Achilles. Okay? That person's name was Achilles. Okay? فالقصة تيجي لها تاريخ ورا. Okay? So it comes with the calcaneum. This is the calcaneum, and that's the strongest tendon over here. فلذلك whenever you look in the book says Achilles tendon, تعرفون ليش سموه Achilles. Okay? There are some bones over here. You can have a look at them, study them at home, and look at the sequence for these ones as well. Now what we are looking at the foot, we'll come to the arches of the foot. Okay? We have arches in the foot, which is very important, and we have 3 arches. We have 2 longitudinally, 1 transversely. Longitudinal, 1 on the medial side, 1 on the lateral side, and 1 is a transverse arch. Okay? هذه جدا مهمين. If you look at your foot touches the ground like this. The medial side is an arch, the lateral side بعد arch, الميديال أرفع من اللاترال. Okay? اللي ما عندها الارش هذه نسميه flat foot. Okay? Flat foot. Okay? انحنائي. This is an arch. انحناء الميديال أكثر من اللاترال. فلذلك لو تشوفون في السوق الأحذية، في أحذية مكتوب عليها أحذية طبية.
Or for the arch speed.
Okay? Now these are also known as anatomical shoes. يعطونهم اسم ثاني, they call them anatomical shoes. Okay? ليش يسمونهم anatomical? Because they put the arches in it. Now what's the disadvantage? For those who do not have the medial arch, they will have leg pain, they won't be able to walk for a long time. Or running, and that is why they never took them in the army. في الجيش ما كانوا ياخذونهم اللي عندهم الديفكت في الارش. فالفلات فيت ما كانوا ياخذونهم. اوكي؟ بعدين the armies walk يسمونه march walk, ضرب على الرجل كذي. عدل لا؟ So this is marching. اوكي؟ مارش وفوق ما عندي ارش رحت فيها. اوكي؟ فلذلك they tested them. الحين احنا اللي ناخذ حتى في البحرين كانوا يشيكون هذه بعد بس انتم اللي رحتوا فور بروفيشنال يعني تمريض ولا دكاتره ما نشوف هاي، بس عسكري نزين لا they will check if I'm flat foot or no. If I'm flat foot I'm refused. Now what we do then, flat foot is not bony problem, it's tendinous problem, it's ligamentous. It's ligamentous مو bony. اوكي؟ الحين اللي عنده problems لو واحد كبير، احنا عندنا في البحرين we have the physiotherapy center. The patient we refer the patient there. زين؟ يشيكون له شكت عنده الارش، يسوون له سول، زين؟ يخليه في الحذاء داخل This is insole. Okay? Which has the arch. ناخذ القياس ماله and we give the patient as insole to wear in the shoes, male or female. We give for both. طيب بس مهم ان لو شفت انا هالشيء هذه في الاطفال, we can help the children when they are young before the age of 6 and 7 because the ligaments are weaker, are not that strong. فانا ممكن اعدلهم. There are shoes we make for the kids, for the small babies. We make them wear and the arch becomes improved, becomes better. And since these ligaments are stretchable, then I can improve the arch ماله بيصير أحسن. Okay? So if you see at home, for example, and look the foot of the child is flat, get it checked up and try to help them when it is the proper time to help them. Okay? And by the way, once I was in Istanbul, the Prophet صلى الله عليه وسلم he had flat foot. الرسول تشوفون آثار الفوت ماله زين. when I أنا anatomical eyes لا فشفت بنظرة anatomist فشفت قلت له والله هذه flat foot هذه احنا نظرتنا غير لا. نفس الشيء كنت في القاهرة في الأهرامات. ها أنا preserve bodies. إنزين هم الفراعنة they were famous for preservation. إنزين الحين في كتابات عليها when they used to preserve. إنزين كانوا يطلعون الأورجنز من الداخل كلها تعلمهم الحيوانات except the heart. القلب ما كانوا يطلعونه. فسألت أنا ليش؟ زين؟ إيه ليش هذه ما طلعوه؟ زين؟ الحين من ضمن الأشياء المكتوبة هناك زين؟ The reason why they did not take the heart out كان الروح لن ترجع تتعرف على صاحبها. صور إيه؟ إنزين؟ ترجع تتعرف على صاحبها. إنزين؟ فكان they used to keep the heart there. Okay? So there were reasons for that. هما they learned it from animals like that. And they had a concept. يوم الآخر في حساب. زين؟ There was a drawing on the wall. عالم وميزان كفين. One stands on one side. On the other side is the heart. Not the brain. الكف الثاني there's a heart here. مو مخلين هاي. Okay? So those concepts were there at that time. Now we look at the arches. I said we have two longitudinal arches and we have one transverse. This is a lateral longitudinal. This one is the medial longitudinal and this one is the transverse. The medial longitudinal is higher than the lateral. The medial is higher than the lateral. Okay? I want you to look at the next slide to look at the bones which take part in the arches of the foot. If I look at the medial arch, it's higher than the lateral. If you look on the bones which participate, calcaneus, talus, navicular, and 3 cuneiform bones, and the first 3 metatarsal bones. Okay? هذولا on the medial side اللي يشاركون في forming the medial arch. Okay? Now if I look at the lateral arch is not as high as the medial, it's lower than the medial. It's calcaneus, cuboid, 4th and 5th metatarsal bones. لأن هذه جاية على الجهة الخارجية, the lateral side. Okay? So these form the lateral one, the previous one forms the medial longitudinal arch. بعدين كان عندي إن when you look at the transverse arch is a small arch, it's a half arch and transversely. Base of the metatarsal bones, cuboid, and 3 cuneiform bones. هذه transversely. بس الأساس اللي عندي is the medial and lateral. اللي ما عندهم الارch بشوف the foot, the whole of the foot touches the floor. إنزين؟ فكأن اللاترال عنده بس الميديال بالمرة رايح له. خلوا في اعتبار this is not bony defect, it's ligamentous, which could be cured. We can help the children. Adults لا, لأن ليش؟ The ligaments already grown up. فأنا I put a cushion in their feet. زين؟ أساعده في المشي. يعني لو أنا عندي sole insole حق suppose I'm flat foot, عندي insole in my shoes, that will help me even when I walk for a long distance ما بتعب فيه.
أو هذا يسوون نوع الربر حق الشوز الأخضر عشان تساعدهم في المشي.
أي في كوشن على الهيل. مو العضلات ligaments. لا شوفي الحين when you go for the muscles of the leg, the tenderness attachment of muscles of the leg goes to the feet. اي العضلات شوفي العضلة لها مكانين تلصق فيها. لا عندي على اللج وعندي على الفوت. العضلة نفسها تمشي كذي تروح للفوت. العضلة هذه لو رحت الرياضه عدلتها الليجامنتس اللي بيجيني التندن اللي بيلصق هناك بعد بيصير احسن. اوكي سو ذا بس الاساسي قلت لكم is ligamentous problem. زين عند الليجمنت كذي يمر بالكامل ها when the ligaments are but اقدر اساعد اكثر حق الرياضه then the tendinous attachment of this muscle زين will improve. اوكي فمفيده صح بس المشكله صايره في الليجمنتس. اوكي I've put some slides for you for the so you can have a look at them in the museum at home. لأن هالصور ما عندكم في الكتاب. You can look at the bones and try to identify. هذه مهمة حق الامتحان النهائي. امتحان النهائي بيكون فيه أوسبي. So if I put on the table and ask you identify this bone, هذا بيسهل لي المراجعة. Okay? Here is the medial side, so you can have all the bones that you have for the foot itself. Okay, these are the ones. Now we look at the hip bone. Next, please. الأوسبي بيكون merge الاثنين. فيها histology وفيها gross anatomy. زين؟ يعني قد يكون فيها صور، قد يكون فيها bony structures ويكون فيها histology بعد. So those structures that you can see, identify and then build up on those. بيكون فيها الاثنين. اوكي؟ بس اوسبي ما عندنا في الميد تيرم. اوسبي عندنا في حق شنو؟ فيسيولوجي فيها اوسبي في النهايه. مو بالحين ميد تيرم حتى في الفيزيولوجي ما بخلي انا اوسبي حقكم. اوكي I'm the person who will put the stations. فيزيولوجي ما بخلي. اوكي فيزيولوجي بخلي في النهايه. في الميد تيرم ما بخلي فيزيولوجي اي ستيشن. اوكي انا المسؤول حق البرنامج كله. I'm the coordinator for it. I'm not going to put any physiology OSPI in the midterm. No. نعم؟ ولا اناتومي في الميد تيرم. ميد تيرم ما بخلي اوسبي، لا اناتومي ولا فيزيولوجي. في الفاينل بخلي. اوكي؟ نعم. لا هي بعدين. هاي بطلع نسبة. ترى على فكرة حتى your attendance has percentage. So keep in mind that there is a percentage even for your attendance. Okay? Now when I look over here at the hip bone, and the ilium, ischium and pubis, there are three bones which unite, will ossify together. Ilium, ischium, pubis. Okay? Now we look at all of them. What is the role over here is protective organs, protecting the urinary bladder, the reproductive organs. So this is the bony structures which are over here. This one is the ilium, this one is the ischium, and this one is the pubis. Ilium, ischium and pubis, they unite. ممكن نشوفهم developmentally على الاسيتابولم. هذه الاسيتابولم مكان اللي بيجيني the head of the femur. Okay? this one is the sacrum. هذه العظمة هذه sacrum. هذه sacroiliac joint. زين؟ هذه pubis symphysis. What type of joint is this one? Pubic symphysis? هذه slightly mobile يعني cartilaginous. اوكي freely mobile احنا قلنا synovial. انتوا اخذتوا الثلاث الانواع. نعم بشرح الاسبوع الجاي. اوكي الاسبوع الجاي I'll come to the joints. I'll explain all of them. اوكي اي بس ما بيكون معانا في الامتحان. اوكي اللي بيكون الاسبوع الجاي مو معنا في الامتحان في الاوسبي ميد تيرم الى بكره. بكره اللي بيكون ويانا يشمل في الميد تيرم اخر شيء. الاسبوع الجاي لا. نعم الاسبوع الجاي عندنا محاضرات بس ما بشملها في الامتحان. بسوي ان شاء الله. بسوي لكم بعد مثل ما اخترت اسئله بختار اسئله الاسبوع الجاي بسوي معكم مراجعه بعد.
الفسيولوجي ما بيسوي حقنا؟
المفروض يسوي ما سوى؟
لا
بكلم.
مرة بس اعطونا مثال سؤالين بس.
بكلمه. اوكي؟ بكلمه على الاقل الاسبوع الجاي يسوي لكم. ان شاء الله. اليوم بكلمه ها؟ هذه these are the pictures that نعم الليبلينجز over here هذه تحفظونها متى حق الفاينل. There is no labeling in the midterm but there will be in the final because you have an OSCE exam. Okay? فالصور اللي خليتها it will help you to identify and memorize for the final. Now we look at these are the 3 bones. You look at them. خليت the real bones you should be able to identify. This is the acetabulum. Okay? And قلنا what type of joint is this one with the acetabulum? شنو الجوينت هذه؟ مع الhead of the femur. What type of ball and socket? What type of joint is this one? Bad ball and socket. Which is more stable? The hip. And which is more mobile? Why this one is more stable? Okay, very good indeed. Okay, so you have the reasons for it as well. Okay. Now we look at the pelvis. There's a difference in a male and female. Okay. You can identify the difference with your naked eye as well. Okay. So you look at the shape of the pelvis without looking. If I look at the skeleton, هذه more prominent in males than females. The other part is looking at the hip. زين؟ منها بعرف ان هذه ميل ولا فيميل بعد ها؟ لو ما عندي الكله انا ترى for the CID over here الفرنزك ساينس انزين فرنزك انا درستهم في الصيف انزين فاللي يشتغلون في الفرنزك زين انا اديهم هني واللي يشتغلون انا اديهم هني ادرسهم فرنزك زين انتوا المنهج ان الكريكولم ما فيها فرنزك بس انا اللي كليه الطب اللي كنت فيها كان عندنا فرنزك. Okay, so I teach them forensic as well. Anyhow, you look at them, you should be able to look at the differences between male and female. You look at shallower, okay, sacrum is shorter and less curved, and so on. So you look at both the male and female. عندي مكان اسمه pelvic brim. Pelvic brim, if I take at the promontory of the sacrum, انتفاخة الساكرم، بجي هني قدام على الحوض هني at the anteriorly، هذه الدائرة اللي تكونت this is known as pelvic brim. Pelvic brim بيكون فاصل بين true pelvis and false pelvis. So معناته الحين I'm talking about two pelvises. I'm talking about false pelvis and true pelvis. The true pelvis is the one which is surrounded by bones. اللي محاصر بالbones that is true pelvis. فوق المنطقة هذه this is false pelvis. Okay? So الفاصل بين false pelvis and the true pelvis is the pelvic brim. Pelvic brim. زين؟ من ورا بيكون promontory of the sacrum، بجي قدام these bones the upper surface. هذه الدائرة هذه بسميه pelvic brim. هذه there is a joint over here. This one, if you look over here, what type of joint is this one? This is no, this is slightly mobile, so cartilaginous joint, okay, slightly mobile, okay. So I want you to look at the pelvis and try to reach all of them. Thank you very much indeed. inshallah الأسبوع الجاي بغطي شوية أشياء, so we'll have some revision as well. Okay, I wish you all the best, huh?